Good evening, doctors. Welcome again. Myself, Dr. Hemant Sharma, and today I am going to explain you how to prepare for Neet PG 2021 exam. Guys, this year they like to ask clinical based MCQs, and now you have a lot of time in your hands. If you want to crack the exam in a first attempt, you have to follow me. Follow my all videos which I am going to put, like psychiatry, clinical, one-liners. That is very high yield. Clinical. This time I am not going to put direct one-liners. This time that is clinical based. And according to my point of view, if you remember 10,000 clinical one-liners of all subjects, then you are able to crack not only the Neet PG but AIMS PG, JIPMER, PLAB, USMLE, everywhere, any exam in the world, and in your clinical practices. In your clinical practices also, that is very much helpful because you are going to know how to prepare. So I like to put every day a new videos like neurology clinical one-liners, that is part 1. Part 2 I already put. Psychiatry, yesterday night I put a part 1. And in between I really like to prepare you for MRCP examinations also. That is also helpful for you, those doctors who want to study in UK. So please go through and study well, study hard, and I will give you the example how to study. For that I will explain you. If they like to ask a girl whose age is 9 years, or whose age is 70 years, or whose age is 30 years, if she has a severe hematemesis, what are you going to do? So guys, you have to go through the endoscopy. Why? Because you have to find the source of bleeding and go through endoscopy and embolize the vessels. And if you are not going to find the source, then you are not able to treat the patient. So such MCQs you have to attempt and you have to answer. That is clinical. If somebody comes in your OPD, a male whose age is 70 years and he has a frank hematuria, so what you are going to do? Guys, in such condition you have to go for cystoscopy. Cystoscopy, you can find the source of bleeding and you can cauterize the vessels. Okay, stop the bleeding source. So always you have to go through the treatment. And I will give you one more example in psychiatry. What if a patient having a habit of washing hands more than 30-40 times in a day and regular, that is what? Firstly you have to decide this is OCD, obsessive compulsive disorder, and how to treat. The first line treatment is not by drug therapy, by CBT, cognitive behavior therapy, and second line is fluoxetine. So you have to remember, in mild depression the best therapy is CBT, cognitive behavior therapy. Just same in all subjects, you have to prepare. For rheumatoid arthritis, how to diagnose? By antibody, which is most specific, that is anti-CCP. So you have to remember in such pattern. So guys, if your basics are strong, you are going to clear the exam in a single attempt. For example, we take from gastro, we already took an example, and in hemato, lot of things you have to remember, but your basics should be strong. Okay, so guys, prepare well, follow my all videos, and thank you for watching my lecture. And if you have any queries, any question, you can ask me. And if you still not subscribe my channel, please subscribe it. In addition disease from endocrinology, what you are going to find, there is hyponatremia but hyperkalemia. Such finding, hyperpigmentation, you have to remember. Cushing syndrome by whom? It is due to steroid induced Cushing syndrome. Cushing disease, it is due to tumor. What is MAN1? What is type 2? What is type 1? So in diabetic foot ulcer complication, the drug of choice in diabetes type 2, that is insulin. So any complication develops post MI patient. So you have to remember complication of drugs side effects. Okay, you have to remember. So this year I have a lot of time in my hands. So this year I decide subject wise clinical important one liners. Go through that, and if you follow me, no need to follow any another notes. That is more than enough, which I am going to put on my channel. My target to complete all subjects, to cover every subject. That will help you a lot. Thank you. Good day. Goodbye. That's all for today. And if you like this video, put like on it. And if you have any queries, any questions, any doubts, you can ask me in a comment box. Thank you. Good day. Goodbye.